my co-chair Wilma of the Metropolitan Hospital, and they're having a meeting today. So I wouldn't even send out email. Like I can't send out emails to them because. So I was disappointed that this sort of interfered with a lot of other things of the people. But I'll make sure they get the video.
Yeah. Sometimes people prefer watching the recording anyway because
Yeah,
they can do it at their own on their own time.
but then they can't ask questions.
That's
So
true. Yeah, we do. Yeah, I'll be sharing the helpline number, so at least people will
good.
have some resources after.
Oh, good. Judy's on. Hi, Judy. And Meryl's public member. Okay, when Will comes back.
All right.
I
Let me
think
go
we
ahead
should
and
wait.
you want
You
me
can,
to give the preamble?
sure,
I know it's a small crowd,
it
but
is
that's okay.
usually get
Um,
more, but we'll get
yeah,
more.
I imagine folks will come
Either that
a
or I'll
little
make
bit.
sure that that the video goes out.
Yeah.
I was just saying that the reason Wilma's not here is there's an important meeting at the Metropolitan Hospital
I
CAD
heard, yeah.
that we both belong to, that it was partially something she had to go to. There's another group that I belong to that is having a major thing. So I can't even send out to these people. It isn't like just one or two people couldn't go, but I was told don't even send an email invite because it would be conflicting. So it's
Well,
okay. They'll get the video.
for the folks who are here and maybe unfamiliar with our
Sure.
Zoom committee meetings, first thing you'll notice is that you're currently muted. The only folks who will be unmuted through the duration of the meeting are Barbara, and if Wilma shows up, and then our presenter. If you would like to speak or ask a question or make a comment at the end of the presentation, you can go to the React icon on your device and press the raise hand button. Only press it once. If you press it a second time, your hand will go back down. If you're calling in from the phone, it's *9 to raise your hand and *6 to unmute whenever you're called on. And then just be on the lookout for a prompt asking you to confirm unmuting whenever Barbara calls on you. And if you're having any problems, the chat is available for technical support. It's not to ask questions of Barbara or our presenter. They'll never see those chats. So if you have any problems, you can chat me and I'm happy to help. With that, I'll hand it over to Barbara and she can get the meeting started.
Thank you. We started thinking about it was actually my co-chair Wilma, who can't be here, that said, this is when when we get 20 million phone calls, those of us that are of age, the phone doesn't stop ringing with people selling some sort of Medicare, most of the time Medicare Advantage. When I spoke with people, I found out that people didn't know the difference between Advantage and supplemental and why one instead of the other and so on. So we had the idea for this meeting, and I'm so pleased that Emily Wichelo, and she is the Director of Education of Medicare Rights Center. So we're so pleased she's here. She's going to tell us everything there is to know about Medicare, everything that's new in Medicare and Medicare Advantage, and the difference between everything. So thank you so much, Emily, for coming.
Yeah, thank you, Barbara, for reaching out to us and for that really nice introduction. I have some slides that I prepared so that we can have a visual to go along with everything. But yeah, as Barbara mentioned, around this time of year, you're probably all getting inundated with phone calls or emails or regular mail about the different Medicare options. Usually these private plans, they're the ones that use their budget for all the marketing. And it's kind of a confusing landscape, especially in New York City. There are a lot of options that you have throughout the year. And so today I'll be going over what the different Medicare options are, what they cover, what kind of questions to ask yourself to determine what type of coverage is best for you. And then I'll end by talking about programs that help pay for Medicare costs, because that is one of the main goals of the Medicare Rights Center, is to make sure that people who are eligible for benefits know that they exist and know how to enroll. So as Barbara mentioned, my name is Emily Witchlow. I'm the Director of Education at the Medicare Rights Center. We are based in Manhattan, but we are a national nonprofit consumer service organization that our main goal is just to make sure that older adults and people with disabilities have access to affordable healthcare. So we have a national consumer helpline through which we do counseling and advocacy. People call us with their questions. We do educational programming like presentations throughout the city, and we run a couple of educational websites. And then we have a public policy team in DC that works to strengthen and protect the Medicare program. So we have a lot to cover today, and I hope that we can just give a sort of cursory understanding of all of these different topics, but we'll be talking about the differences between original Medicare and Medicare Advantage. We will talk about how to find Medicare providers. When I was speaking with Barbara in preparation for this meeting, something she mentioned is that sometimes it's hard to find providers in network or who take Medicare. So we'll just talk about how to find those providers. All of this information is underscored by the fact that the open enrollment period is happening right now. So we'll talk about the changes you can make during this period when it occurs. We'll talk a little bit about marketing rules so that you know what plans can and can't say, what to do if you think they've broken the rules. And then lastly, we'll identify some programs that help pay for Medicare costs. And I guess, as was mentioned, you aren't going to put questions in the chat, but I will stop sort of periodically to see if people have any questions. Feel free to use the React button if you would like to ask one. So first, an overview of Medicare benefits. And if you already have Medicare, you've had it for a while, this might be a review. But there are three main parts that you hear people talk about. The first is Part A. If you have that red, white, and blue card from Medicare, it says Part A on it. That covers your hospital or your inpatient benefits. There's Part B, like boy. Those are the doctor, the outpatient benefits. That's the part of Medicare you might be familiar with. It has that 20% that you owe. Medicare pays 80%. And then lastly, we have Part D, like dog. That's the prescription drug benefit. And so the reason why these parts are important to know about is because each part covers different services, and the different services have different costs associated with them. So for Part A, it covers inpatient hospital care. It also covers skilled nursing facility care. This might also be called like rehab care. It's kind of the types of services you get after you've been a hospital inpatient. You might go to a skilled nursing facility or a rehab facility for rehabilitative care, like physical therapy after hip replacement, for example. Part A also covers home health care, which is services you receive in your home if you're homebound. And then lastly, Part A also covers hospice care, which is the type of care that you can choose to receive if you have a terminal illness. It provides palliative care for people nearing the end of their life. On the other side, we have Part B, like boy. That was the outpatient services. And there are so many different types of services you can receive as an outpatient. So we can't list them all here, but sort of main categories are provider services. So that's if you go to the doctor, if you go to the cardiologist, if you go to a physical therapist, they're covered under Medicare. Medicare also covers durable medical equipment, or DME, under Part B, like boy. It covers ambulance services, usually just in emergency situations. It covers preventive services like screenings, colonoscopies, mammograms, things that detect an illness or to try and keep you healthy, recognize things before they happen. It covers therapy services like physical therapy, occupational therapy, and speech language pathology. Mental health care services are covered, x-rays and lab tests. And this is not the end of the list by any means, but something else I wanted to point out is that certain chiropractic care can also be covered under Medicare Part B. So in general, things that you're getting outside of a hospital as an outpatient, that's covered under Part B, like boy. With the covered services, we also need to talk about what is not covered by Medicare. And this is always probably my least favorite slide to present, because I don't like to talk about the things that people don't have access to. But Medicare excluded services include alternative medicine, most care that you receive outside of the US. So if you're traveling and you need to go to the doctor, in Italy, Medicare doesn't cover that. It doesn't cover cosmetic surgery, most dental care, hearing aids. We'll talk about that in a moment, though. Personal care, nursing home care, homemaker services. So if you just need someone to come in and make you meals or do some light cleaning only, Medicare doesn't cover that. It doesn't cover private hospital rooms, most non-emergency transportation, certain preventive services, and most vision care. So that's an overview of the parts of Medicare and what they cover. And now we'll talk about how, depending on the type of Medicare option you choose, how you can receive those benefits or access them from different providers. But first, because one of the differences between original Medicare and Medicare Advantage is the costs that you might owe, I just wanted to level set with some healthcare vocabulary or healthcare cost vocabulary. So we have premiums. That's the amount you pay every month to have Medicare. If you collect Social Security, the premium's probably taken out of your benefits. You might also be billed for it directly. The deductible is the amount that you owe before your healthcare coverage, before your insurance kicks in. And then co-insurances and co-payments are the cost sharing, the amount out of pocket that you owe, usually, at the doctor's office. So a co-insurance is a percentage of the cost of the service. So a little harder to predict because depending on the cost, 20% of a visit could be different depending on how much that visit costs. Whereas on the other hand, a co-payment is a set amount that a person pays to receive each medical service. And I see we have a question from Judy, if you want to unmute her. Or maybe I.
Judy, I'm muted.
All right, well, that's okay. I'll just keep going. And then if you get unmuted partway through, this is not a super formal presentation. You can interrupt at any point. So as I mentioned, there are two ways that somebody can receive their Medicare benefits. And it's about half and half throughout the country. Half of the people have original Medicare and the other half have chosen a Medicare Advantage plan. And the main difference is that original Medicare is the red, white, and blue card. It's Medicare benefits administered through the federal government. And it just includes Part A and Part B. So if you look at your card, it has your name on it, it has your Medicare number, and it usually says Part A and B on it. If you need prescription drug coverage, you have to get a separate plan called a standalone Part D or standalone prescription drug plan. That's through a private insurance company. It just covers your prescription drugs.
Okay, I think I'm unmuted. Hi. Yeah. Just quickly, you said Medicare did not cover private rooms?
Yeah, at the hospital it covers a shared room
because now new hospitals, example MSK on building on First York Avenue, is going to have 206 private rooms. They're all going to be private in the new hospital. So I think there's also something in the federal government that when they build new hospital rooms, they have to be individual rooms. They can't, 4 people in a room.
Right.
So how is it that they won't cover that?
Yeah, so I'll look more into that. That's a really interesting point that you bring up about requirements. I would guess that if a hospital has no private rooms or if no private rooms or if no shared rooms, if a hospital has no shared rooms or if no shared rooms are available, Medicare is not going to say you can't stay here. It would just cover the stay.
Okay.
Yeah.
Thank you.
Yeah. Thank you for bringing that up. That's a great point.
But can I bring something up in my memory? And if Will is on it, it was either Lenox Hill, one of the hospitals came to us. I asked that question, will Medicare pay for the private room? And I didn't get a very good answer about it. it was not a definite yes or anything like that. It was sort of fuzzy. So, Judy, that's a question we have to keep asking.
Yeah, I'll see if too, Barbara, I can follow up with you if I find anything in like the Medicare manuals. I'm just going to make a note of it now while I'm on my computer.
I hope nobody hears this dog. I don't know what to do. It's not my dog. You
I can't really hear it.
This poor little dog.
Barbara, it's fine. Nobody can hear.
Great. Well, thank you, Judy, for bringing that point up. So, right, original Medicare, Medicare through the federal government, and then Medicare Advantage plans. Those are the ones you see advertised. They're provided by private health insurance companies like United Healthcare, Health First, Blue Cross Blue Shield, and they combine the A, B, and D benefits under one plan. So you have one card that you use when you go to the doctor, the pharmacy, the hospital. And the important thing to note, because sometimes the ads make it sound like this, like you're missing out on Medicare if you don't get a Medicare Advantage plan. It's not a separate benefit. It's just a different way that the benefits are administered. So instead of having the federal government kind of involved in working with its contractors to pay your providers, you're working with a private health insurance plan and the network providers to get your Medicare. And so a lot of sort of one of the main questions that we get on our helpline is people asking, which benefit is right for me? And we really try to, give independent, unbiased counseling. And so we never tell people like, you should take this plan, or you should take Medicare, original Medicare, plus these other types of coverage. And so we structure things around the different types of questions that you might want to consider. So one of the main differences with original Medicare versus Medicare Advantage is your access to providers. So with original Medicare, there is no network. If you live in New York City, you can go to Pennsylvania and get covered services outside of New York City, anywhere in the country covered by Medicare, as long as those providers take Medicare, which, over 90% of them do. With Medicare Advantage, there is a network of doctors in different service areas. So if you live in the city and then you travel outside of it, depending on the size of the network or the type of plan, you may not be able to access covered care. And so a couple of questions to think about if you're deciding between the two options is to look at the providers you currently see, ask them, which types of Medicare they take. Many take original Medicare, but if you're looking at a private plan, you'll especially want to say, do you take Humana? Do you take United Healthcare? Do you take Health First? And getting that information is really important. And before we move on, I see we have a question from Todd. And
I have so many, but I'm going to wait until you're done. I keep adding to the list.
Yeah. Oh, sorry, Todd, you're not unmuted yet, but
sorry.
Okay, I got unmuted. I feel
sorry.
like I was in a debate. I just am curious how much chaos we expect, though, in all of this now. Just in general, are you kind of like hearing much chaos is heading our way?
In terms of like how the results of the presidential election might impact Medicare?
Yeah.
Yeah, I think, well, it's only day 2. Since we got the results, our policy team is sort of thinking through, what we saw last time in 2016 and waiting to learn more about the incoming administration's, feelings about what their priorities are health-wise, who will be appointed as, the head of HHS and Medicare and things like that. So what I will say is in 2016, there were certainly, some tumultuous times, but it was never, things didn't change so drastically. Benefits were not cut and costs did not rise or lower more or less than they have under other administrations. So I think we don't have to fear chaos or worry about chaos.
Well, it's good to hear. I
Yeah.
just think that it's been mentioned a lot. So, in the campaign. So
Yeah. And
hopeful.
there were we heard from people who were seeing ads saying like Medicare will be canceled, things like that. That's, not happening. I'm not even sure how that's, been a law for such a long time. I don't really know how it would just like instantly get taken away. So I would say,
Thanks for your opinion
Yeah.
and thanks for being here.
oh yeah, no problem. Thank you for your
I
question.
cared for my dad and now and my mom is 90, so I'm very well versed on a lot of the things I'll be heading to in the next few years.
Oh my goodness. Yeah. Well,
Hopefully
that's
it
a hard
doesn't
job,
change.
taking
Yeah.
care of parents. Yeah.
All right. Well, thank you. You can mute me if you need to report, or I'll keep going.
Yeah, you want to do the next slide? We can tag team it.
No. Thank you again, Emily.
Of course.
I'm
And yeah,
muting
Meryl, I see you've got a question too. Maybe you can be unmuted.
Thank you. Okay, I have a good question. Somebody was telling me just the other day and was concerned because they had been a member of a union, a city union, and there's an intro floating around called Intro 1096, and it represents, I think it is to keep union people out of the Advantage plan. Why are the unions in favor of the Advantage plan and the congregations against it? The union people. What is it about that bill? What is it about that plan that makes them so aversive to them?
Yeah, so I don't know specifically the legislation that you're referring to, and we're also not, maybe
It's
as
Chris
steeped.
Marte and the council. I don't know what's going on in the assembly.
So there has been a lot going on with union coverage, with retiree coverage for retired city employees. Right now, the coverage is kind of original Medicare with a city-sponsored Medigap, a supplemental plan. There have been ideas, I think, for at least 2 years or so, to change it to a Medicare Advantage plan. And one of the oppositions to it is that people feel that it would be more expensive to them as the consumer and that their access to providers might be diminished.
Exactly. They would have to pay a premium. They would have to pay an additional supplemental fee for it.
Yeah,
now,
and
is
so
that fair? Is there a way that because it's an Advantage plan that they can corral so many people into it without, as they would for a Medigap plan?
yeah, so I'm not sure about the reasoning why some people are for it and some people are against it, or what the right move
Well,
is.
it must be a substantial difference in the in the quarterly fee. They may as well say, it goes up from 1,000 to 5,000. That's a lot of money for retirees on pension.
Yeah.
All right, I'm not sure what the facts are. I'd have to go back and do.
Yeah, and we can't really comment on it because we're not involved in that, those negotiations or that decision-making process. And then Ellen.
Yeah.
Ellen Pallavi, if you'd like to say something, you can unmute, but you are not doing so. She's not at her camera, so I think you could just move on.
Cool.
Okay.
Yeah. Feel free to interrupt me later. So, yeah, as we've determined, access to providers is a sort of main concern of people with original Medicare versus Medicare Advantage making that decision. Other questions you might want to consider are about the covered benefits you'd be able to receive. So as I mentioned, with original Medicare, hearing, vision, and dental coverage, those are kind of the three main categories of services that people want to and need to receive, but original Medicare does not cover. One of the things that Medicare Advantage plans like to use as their selling point is that they have this flexibility to provide additional benefits that usually are not covered, and this includes hearing, vision, and dental. This is not to say that Medicare Advantage plans provide super comprehensive dental coverage or hearing or vision coverage. It's more that, you might be able to get the 2 dental cleanings a year, or a Medicare Advantage plan might pay money towards a pair of prescription glasses, or might pay money towards hearing aids. So one thing to think about, especially as you're seeing advertisements about Advantage plans, are there any rules or restrictions that you should be aware of when accessing these benefits? Are there, certain providers that you have to go to? Is there a limit? Is there a dollar cap on how much is covered? Because naturally, advertisements like to make things sound like they're more expansive than they are. And so when you're considering between original Medicare and Medicare Advantage, if these supplemental benefits are a selling point for you, just sort of dig a little deeper, call the plan, ask more questions about what's covered, how much it costs, and if there are any special rules you'd have to follow to get it covered. That being said, with original Medicare, some people say, I do need dental care, but I also want original Medicare. The kind of only option would be really to get just a standalone dental policy from a private insurance company, kind of separate from the Medicare program. Oh, and this kind of reiterates a little bit what I said about Medicare Advantage plans and supplemental benefits. Again, just carefully read plan materials and contact a plan directly with questions. If you are attracted to a plan because of a gym membership or some other benefit that it provides, also make sure, does it cover my prescription drugs? Are my providers in network? What are the costs? Do I have to get prior authorization before I see certain doctors? There's more to consider than just this coverage for supplemental benefits. Another point that you might want to think about when comparing original Medicare and Medicare Advantage is how much it costs. So how much should you expect to pay for premiums and deductibles and co-payments? With original Medicare, there is no limit on out-of-pocket costs, but people with original Medicare have an option to purchase supplemental coverage called a Medigap. The Medigaps have a monthly premium, but pay for the out-of-pocket costs when you go to the doctor. So, kind of paying this premium to have a plan, but then when you go to the doctor, you don't have out-of-pocket costs that you owe. On the other hand, Medicare Advantage plans do have a limit on out-of-pocket costs, but as we'll see either on the next slide or in a couple of slides, it's over $8,000. So that out-of-pocket limit, protects you if you have very expensive healthcare needs, but it's not going to necessarily kick in if you only go to the doctor a few times a year.
Can I ask, what is Medigap? Is that supplemental?
Yes. So Medigap policies are a supplemental plan that they're standardized. You can see here on this slide, I've listed their different plans, A and B and C.
G.
And G, G
Right.
and G and D like dog are probably the most common right now.
Right.
C and F like Frank are available to people who turned 65 before 2020. And those are also very popular for people who are, a little bit older.
So supplemental is not available if you have Advantage.
That's correct. Yeah.
Okay.
These only work with original Medicare, and it's
Okay.
confusing because
My
Medicare
questions.
Advantage plans call
Yeah.
themselves supplements sometimes. This word
Yes.
supplement is like floating around in the ether constantly.
Okay.
Sorry, I'm going to mute for a sec.
This is
Thank
very,
you.
I've been on Medicare for a long time and I'm learning. I just
I
do
mean, if
things
it's
broadly.
if it's working for you, then no need to delve into the details. But
Right.
yeah, so Medigap policies, for example, might pay the 20% co-insurance that you owe at the doctor. And so in New York State, you can purchase a Medigap at any time. So what people kind of tend to do is, if they know, oh, like this is going to be a big year, I have a surgery coming up, they might purchase a Medigap so that when they go to the hospital, they have that coverage that will kick in and pay for their out-of-pocket costs. And then other people just like to have that extra insurance, and they purchase a Medigap policy right away. And then if they do need it, it's there to help them.
And you could change it if you have a lesser one, you could change it to a G, for instance, or
That's
something
correct.
like that.
Yep.
Okay.
Yeah. So luckily in New York State, the enrollment rules are pretty simple. You can get a policy at any time, at any age, when you have Medicare, whether you're over 65 or under 65 with a disability. Outside of New York, it's a little more complicated. So I'm glad to be speaking to a New York audience for many reasons. And here's a side-by-side comparison. Yeah, so I'll stop here for a sec and see if, I think Ellen's hand is maybe still from before, but Meryl, if you have another question, feel free to, we can
So
unmute
we do
you.
actually have Ellen. She is here. As you heard her echo just a moment ago, we're going to try unmuting her. But if she doesn't solve her audio problem, we're going to hear a really awful sound. And so let's give it a go. Ellen, you can unmute. Yep, still same as you just did earlier, *6.
Okay, now I'm unmuted.
wonderful.
Hi. Okay, sorry, I had to call in on my phone because my connection is not very good on the computer. So I did want to ask about to get back to the treatment requirements in the Advantage Plan. Do you know if doctors have certain treatment requirements for different illnesses in the Advantage Plan? Because that's what I had been told by some doctors.
I'm not sure. What do you mean by treatment requirements? Like you have to meet certain criteria before?
Correct. You need to, in order, if you're, depending on which Advantage Plan you're in and which disease you have, or illness you have, or whatever condition you have, the doctors are hamstrung by that particular managed care plan, that they have to provide certain treatments first before they can go on to the next treatments. And or certain tests before they can provide treatment, or certain medications that they need to use first, like a step up in medications before they can go on to the medication they really think you will benefit from. They have to try the lower cost ones.
Yeah.
So, or I'm not sure that I'm not sure if you mentioned that, but people have more, they have to go for pre-certifications before they can get higher level treatments, which you don't have in the traditional Medicare. So that's something that people might think about when they're looking for, when they're buying a Medicare Advantage plan, and the broker tells them, well, if your insurance broker, and if all your doctors are here and all your medications are on the list, then you're good. You're good to go. You'll get the same care. And I'm thinking, well, maybe you won't get the same kind of care. I was at the physical therapist once when I was getting a lot of physical therapy, and she was complaining how a patient that had a serious condition was only given 5 sessions. How am I going to teach this person how to walk again with 5 sessions?
I know.
So that's the managed care that people are buying.
Yeah. Thank you for thank you for sharing like actual experiences with this, and providing like a word of warning again. Whatever promises somebody makes about a plan, really make sure you dig into that. There were a couple of things that you were speaking to that I want to point out. The first was that Medicare Advantage plans will pretty frequently use something called prior authorization. You might be familiar with it from your own plan or plans you had before Medicare, where especially if you need like expensive services, your plan wants your doctor to ask the plan for permission first before the plan says, okay, we'll cover this, we'll pay for this. Original Medicare doesn't really have prior authorization for anything, and so you wouldn't have to have that extra step before getting something covered. Sort of in the same vein, with original Medicare, there's no referral required for a specialist, so you can just kind of go straight to whatever specialist you want to see, and Medicare, as long as that specialist takes Medicare, will cover it. Whereas with Medicare Advantage plans, especially the HMOs, they often require you to see your primary care doctor first get that referral and then go to the doctor. So again, that's like an extra step. And then also, as you mentioned, Medicare Advantage plans have to cover everything that Medicare does. Medicare covers physical therapy, so the Advantage plan has to, but the number of sessions that it covers before maybe you need to appeal and ask for additional care might be different than under original Medicare. And then lastly, this idea or this sort of structure that Medicare Advantage or that the prescription drug plans have, and non-Medicare drug plans have this too. They call it step therapy, where if you need an expensive drug that's on a higher cost tier, your plan will often say, okay, we want you to try the lower tier, lower cost generic version first before we cover the more expensive version. For a lot of people, the reason they're taking the expensive version is because that's the one that works, or they can't take the lower cost alternative because it has a bad reaction for them. And so a doctor might feel perhaps compelled to have someone take the cheaper version first, but if you want or need rather the higher tier version, the higher cost version, you have to appeal and ask the plan to make an exception. So yeah, these are all things to consider when choosing a Medicare Advantage plan or a prescription drug plan, if there are any coverage restrictions that might add an extra step or barrier to you receiving covered care. Just in the interest of time, I will move on to talking about Part D coverage just for a moment. So we touched on it a little bit, but if you have original Medicare, it only covers the A and the B. And so to get the Part D drug plan, you have to purchase a standalone drug plan. Whereas with the Medicare Advantage plan, the drug benefit is included in the whole suite of services it covers. A couple of important things to know about prescription drug plans is the formulary. This is that key word that refers to the list of covered drugs. If you take a lot of prescriptions, you want to make sure that they are on the plan's formulary, that they are on formulary drugs. We unfortunately cannot make any sort of sweeping statements about how much these plans cost because each one charges different premiums and deductibles and co-payments and works with different pharmacies. Medicare.gov is a great resource that you can use, or our organization can help you use, to look up drug plans and the drugs you take and the pharmacies you go to and see which plans would be cheapest. The average Part D premium nationally is about $36, but I do know in New York, our cheapest plan is like $38 next year. It went up a lot.
A month?
So $38 a month, yes. Yeah. And then the maximum deductible that a plan can charge is $590. And sort of harkening back to what we talked about a moment ago, prescription drug plans use tiers to categorize drugs: high tier, higher cost, low tier, lower cost. And so again, when you're looking at plans, they all have different relationships with different pharmacies and different pharmaceutical companies. And so some plans might have, some generic drugs will be cheaper than others, and then another plan might have different generic drugs be cheaper. And so it's really, important to use Medicare.gov to compare your options, or, you can call us for assistance. The outlook is not all bleak with prescription drug costs. The Inflation Reduction Act, which was passed in 2022, has various provisions, some of which will be taking effect in 2025. So the biggest change is that starting next year, your annual out-of-pocket costs for Part D will be capped at $2,000. So if you have high drug costs, what you pay for the deductible and co-payments and co-insurance charges, after $2,000, you pay $0 for the rest of the year. And so this is different from this year, where before reaching this catastrophic limit and having no cost sharing, you had to spend, closer to like $8,000. So that's, and it won't impact everyone.
Get political, but somebody else will get credit for
it. They might. But yeah, so we'll see how that goes. And sort of related to this $2,000 cap is the introduction of the Medicare prescription payment plan, which must be offered by all plans starting next year, but you can opt in, now. You can sign up to basically have your prescription costs spread out throughout the year. So the best sort of case example for who this would benefit is someone who, they take an expensive drug. Maybe they know that in February they're going to hit the $2,000 cap. Instead of spending $2,000 just in the first 2 months of the year, they can spread it out throughout 12 months and, have a little bit of, an easier way to budget and to spread that out. It unfortunately doesn't lower someone's costs. It just gives them the option to sort of have that divided by 12 and pay it throughout the year. Two changes that have already taken place, but I just wanted to remind people of that were also the result of the Inflation Reduction Act. Vaccines, so like the shingles vaccine, the RSV vaccine will have $0 cost sharing and no deductible. So, you go to the pharmacy, you get the vaccine covered by your drug plan, you pay nothing. And then if you take insulin, your co-payments are limited to $35 per month, or $35 per each month's supply for Part D and Part B covered products with no deductible. So in previous years, before this took effect, people had, could have very expensive insulin costs. $35 isn't nothing, obviously, but it is, lower than it used to be.
Can I just say, so
Yeah.
Medicare Advantage would be the same thing?
Correct. Yeah.
Okay, so this is across Medicare Advantage, whatever.
Exactly. Yeah. However you get your drug coverage, whether it's the standalone plan with original Medicare or through a Medicare Advantage plan, $2,000 cap, $0 cost sharing, $0 vaccines, and $35 insulin, kind of across the board. I just have 2 quick slides about finding providers because I think it's a good skill, sort of like self-advocacy skill to have. So as I mentioned with original Medicare, there's no network of providers. You can go anywhere in the US, but you still want to check that your providers are Medicare certified and charge the Medicare approved amount. And how do you find this out? You can call 1-800-Medicare or you can visit medicare.gov/care compare. You can put in the specialty, the type of doctor you're looking to see, your zip code, and then the search results will show you which doctors take Medicare, and then they'll have like a little star if they're the type of doctor who accepts the Medicare amount and will therefore have the lowest out-of-pocket costs for you. If you have a Medicare Advantage plan, as I mentioned, you want to make sure that your providers are in your plan's network. So you should contact your plan directly or use the plan's online directory if it has one. Sometimes people have issues with their plans not having an adequate network. And so in these instances, it's not an instant fix, but you can file a complaint with 1-800-Medicare against your plan, and Medicare can, kind of work with you and with the plan to help you get the in-network care that you need. Okay. And so the context for all of this, like which is the best type of Medicare for me, is because right now we're in the open enrollment period. It started October 15th, it ends December 7th, and it's the time when you can change your coverage for January 1st. And the reason why this time period is important is because especially the drug plans change from year to year. Their premiums go up, their premiums go down, the deductibles change, the types of drugs they cover change. And so even if your plan worked for you this year, it might not next year, just because the plan made changes. And so if you have original Medicare, things are a little more static. You get your handbook, you can review it for any changes. It talks about the $2,000 cap, it talks about the price of insulin. It's really more so if you have a Medicare Advantage or a Part D plan that you want to look out for any notices you might have already received. They can send them through the mail, they can send them through email. You should have gotten them by the end of September. A lot of people, you think it's junk mail, you throw it away, it gets lost in the mail. If you didn't receive your annual notice of change or evidence of coverage from your drug plan or your Medicare Advantage plan, we recommend you contact the plan to have them send you a new one. Maybe it's a digital copy through email, maybe it's in the mail. However it is, the annual notice of change should talk about, are the premiums for the plan changing? Are the drugs covered changing? Are there services and costs that are changing for next year?
Oh, wow. So it's something I should have read.
I it depends. I mean, it's not like the most interesting thing, right? Like, oh, let me sit down and read this long information from my plan. But if you take any prescriptions or there are certain like services that your plan covered or drugs that your plan covered, you want to check and see, how much is stuff going to cost next year? What's going to be covered? So that you're not caught by surprise. So as I mentioned, one way of being able to compare your options, and this is the option that we like because it shows you all plans that are available, is the Medicare.gov Plan Finder. If you work with a broker, they often don't represent every plan, or they might have certain reasons for trying to recommend some products over others. So if you use Medicare's website, it shows you everything, and it's a sort of more even representation of what's available. You can also call 1-800-Medicare and have them help you look up plans for your zip code.
And they would recommend Advantage as well as the regular Medicaid.
Yeah. So I guess when you call, you'd say, oh,
one
I'm
instead of
looking
the other.
for, yeah, they could help you think through that. And then if you said, okay, I know I want a prescription drug plan, they could help you find one that covers the drugs that you take. And the good thing about the 1-800-Medicare number, they're open 24/7. So if you can't sleep and for some reason at 5 a.m. you want to look up drug plans, you can call them. Our helpline is only, 9 a.m. to 3 p.m. So we're not available at all hours. The best way that we recommend is for enrolling in new coverage is to call 1-800-Medicare. That's the government helpline. If for whatever reason there is a mistake, you have more recourse when, it's Medicare that's made a mistake with your enrollment, rather than if you call a plan, maybe they misunderstand what you wanted to enroll in. So we just recommend going through 1-800-Medicare to keep everything kind of under the same umbrella. So as a recap, we are in the open enrollment period now. It ends on December 7th. If you look at your notices and you think, oh, my drug plan premium is going up, or it doesn't cover the specialty medication that I need, try not to wait until December 6th to make changes, because the phone lines are probably going to be quite busy at that time. But, we've got a month to kind of think about what coverage changes you want to make, if any. And when you do make a change, it will take effect January 1st of this coming year. You can change your drug plan. You can switch from original Medicare to Medicare Advantage and vice versa. If you have one Medicare Advantage plan, you want to see what else is out there, you could switch to another Medicare Advantage plan. Sort of any combination of coverage changes is possible at this time. Oh yeah, and I did say I would talk about marketing rules. So plans and their representatives, they're not supposed to use aggressive tactics to approach you or to get you to enroll. They can't approach you in public spaces or set up marketing appointments at educational events or show up to your home if you didn't invite them previously through making an appointment. And so there's a group called the Senior Medicare Patrol, or SMP. And if you think that a plan or plan representative has been acting not in good faith, you can report violations to them. So the last section was just about Medicare cost assistance programs, but before I go into that, I just wanted to see if anyone has any questions about like coverage options.
But I'm going to wait until you're done.
All right, yeah, this section is pretty quick.
Okay.
I won't belabor the points too much. So there are a couple of programs that help pay Medicare costs. The income limits have been increasing, and so in the past maybe you were like, oh, I don't qualify. You might now, so that's why we just like to do a lot of outreach about these. The first one I'll talk about is the Medicare Savings Program, which pays for the Part B, like boy premium, which is $174 this year. We don't know yet what it'll be next year, but it unfortunately usually goes up. I'll also talk about extra help and the elderly pharmaceutical insurance coverage, or EPIC. And then the last program, it's not a Medicare cost assistance program, but it's another type of health insurance, Medicaid. Medicaid can work with Medicare. Medicaid has an income and asset limit, and it pays after Medicare pays if you have both. So If you go to the hospital, Medicare pays first, Medicaid pays second. And something else that is nice about Medicaid is that it can cover services that Medicare does not, such as dental, vision, hearing, and long-term care. For the Medicare Savings Program and Medicaid, as I mentioned, there are income and or asset limits. So with the Medicare Savings Program, you see here, there are these two acronyms, QI and QMB. Those are two different levels. They both pay for the Part B premium, and then QMB, you'll notice, has a lower income bracket. QMB pays for a couple of other costs as well. And there's no asset limit. So, what you have in savings, what you have in a retirement account, that does not, New York State doesn't look at that when determining your eligibility. It just looks at what you get from Social Security, if you have a pension, if you get regular distributions from a retirement account, if you have income producing property, something like that. So the income limits here are around $2,300 a month for a single person, around $3,100 for a couple. If you're under that amount, the state can pay for your Medicare premium of $174. In this last row, I have the income and asset limits for Medicaid. Medicaid is different from the Medicare Savings Program because it does unfortunately have an asset limit. So as a single person, your income has to be below around $1,700 a month, but you also have to have less than $31,000 in assets. And then for a couple, it's around $2,300 per month income limit, and then less than $42,000 in assets. In a moment, I'll talk about, applying for these programs. But the other program that a lot of people qualify for is called Extra Help. It's a federal program. It pays for your Part D premiums and deductibles and co-payments. And if you get the Medicare Savings Program, so if your income is below, $2,300 as a single person or $3,100 a month as a couple, you are automatically enrolled in Extra Help, and you have, lower premiums and lower co-payments for your prescription drugs. And so the Medicare Rights Center, one of the main projects that we work on is helping people in New York State apply. So if you were looking at those income limits for a Medicare Savings Program, you can call us up. Our helpline number is 800-333-4114. We have counselors who are specifically trained in screening you for benefits and helping you apply. Medicaid, we don't do as much counseling around, but we have relationships with a lot of agencies that do help with Medicaid benefits. And so if you call and you're like, oh, I think I might be under income, or I'm interested in learning about how I could qualify for Medicaid, we can do a warm transfer to different organizations who can help you with Medicaid considerations. And then lastly, there's a program called EPIC that pays for, helps pay for your prescription drug benefit if you're below $75,000 a year as a single person, or if as a couple, your income is below $100,000 for the year. And the application for this is pretty straightforward. And so we just refer people to the EPIC helpline, 800-332-3742 to apply for that program. And then I'll keep this page up while I take questions from the audience. But again, our helpline number is 800-333-4114. The hours are 9 a.m. to 3 p.m. And we can help answer a whole host of questions, things covered in this presentation, or more specific issues that you might be having. So thank you all for listening and being so engaged already.
Thank you so much. If nobody else has, I'm going to start off then with questions, unless somebody else's hand. I don't see any other hands. Am I right?
No, Ellen Pallavi.
Oh, Ellen's hand is up.
It just came up.
Okay, so,
Ellen. Ellen will try. Then we'll try. She's on two different devices, so I'm a little nervous.
Oh.
Ellen, you joined Zoom from your iPhone, and so you have the Zoom app probably open on your iPhone. And so you're gonna look for the button unmute in there, but that's me trying to solve a problem. Let's I mean, you can hit the unmute button either on your computer that you're on, that you have your hand up, or your iPhone, but it's not going to be like through the phone dial. You have an app that you opened on your iPhone.
While you're doing that, should I get started with
Go
some
ahead. Yes, I think
questions
that's a
and then just
wonderful idea.
unmute Ellen as soon as you have a chance to do it?
She has the ability anytime she wants.
Great, thanks.
This is impressive troubleshooting.
As you were going, so this may not be in great order, but
Okay.
palliative care, is there a limit? Is there just a very limited amount of that Medicare will pay, and does supplemental pay more for it? I was just thinking I've known people that like in their last stage of life, there was hardly any care for their family member to use.
Mhm.
Is that true?
Yeah, so the Medicare hospice benefit, there is sort of, I think they cover it in like 60-day intervals. This is recorded, so let me just find that for real. But it pays for 100% of the costs. So the out-of-pocket cost to the person with Medicare should not be anything, but the amount of care after a certain period of time, you need to get recertified by your doctor. Let's see what the
And that would be just for medication as opposed to hospice care, somebody with you and taking care of you for hospice care?
it's the medications, but it's also the other services that you need. So like if you need
A
skilled
nurse?
nursing services or a hospice aid or medical supplies or durable medical equipment, things like that are all covered as part of the hospice benefit. When you have been diagnosed with a terminal illness, you've elected to receive palliative care, not care to treat
Right.
the condition.
Okay.
Yeah, I can follow up with, we have a sort of like section about hospice on our website that I can send. Yeah.
There's no part C, am I right? C is in Charles?
Oh, yeah. So Part C is what sometimes people call the Medicare Advantage plans. Some people refer to them as Part
Oh,
C
that's
plans.
right. That's
Yeah.
what we hear. Okay.
Yeah.
Now, I once did something very stupid of getting medication and then I couldn't find it when I needed it and insurance wouldn't pay for it. And they said, don't worry about it. And they had some other insurance that I used, something they said, just go on this website and you'll be okay. So is there some like private things you could use for drugs? And often there's an ad that says go to such and such before paying for something, or should it always be Part D? No.
Yeah, that's a great question. So there are, I think a Good RX is the one that's advertised a lot.
Mhm.
It's a website that aggregates like coupons and
Right.
lower cost prescriptions. It's a private
You still should
option.
have Part D though, am I
Yeah,
right?
so it's not insurance, and not every prescription is going to be available through GoodRx. And additionally, some of the coupons are only for people who don't have like government sponsored insurance. So it's not something that you want to rely on. It's a good option, yeah, in your situation if like you misplace a prescription and you need to get it again, but your plan is like you already have it, we're not going to cover it. Or if you're prescribed a new prescription halfway through the year and it's expensive under your plan, maybe check GoodRx and see if it's less expensive. But with Medicare, if you don't have any drug insurance under Medicare and then later you want to enroll in a prescription drug plan, you'll have a penalty for not having had insurance previously. So we don't really recommend foregoing insurance and using just GoodRx or these other private options because of the late enrollment penalty that you can have later.
Okay, that's good. When I was applying, maybe a couple of years ago, they went through which one and which drugstore I go to. And evidently I chose Duane Reade. And they said, but if you go to CVS instead, it will be much more expensive. So the Part D is also very dependent upon where you get your drugs.
Yes, yeah. They have networks of pharmacies, and you'd think, oh, CVS and Duane Reade are both, huge chains, but depending on the plan, maybe Duane Reade is less expensive than CVS. And then another plan has cheaper drugs at CVS than Duane Reade. So using the Medicare Plan Finder is a good tool, a good option, because you can put in the exact pharmacies that you use and it'll tell you like, oh, under this plan, Walgreens is cheapest, or, that's the
Right.
preferred
What
pharmacy.
scares me is that Walgreens has been closing all over. I think this is my 5th Walgreens that I'm going to, because they've all closed. And if one isn't anywhere near me, I'm now stuck with a plan. Or could I call up and say, now I want a CVS plan instead?
Yeah, you could. Well, you can't always change plans partway through the year, but you could, call the plan and see which pharmacies near you are the preferred ones. Or, if mail order is something you're comfortable with, that's usually a less expensive
mail
option.
order.
Yeah.
And Part D would cover mail order?
Correct.
And what about people? I know some people go to Canada for their mail order drugs. Would Part D cover that?
No, it would not. Cover Canadian drugs.
Oh, that's interesting. Advantage. I know I once said it to you, and I know you have to be fair. I know several people call it disadvantage. I have talked to doctors, and most doctors do not like disadvantage at all. It's very limited, if you do need a specialist and so on. Is this something you don't want to respond to? I know you have to be fair, but is that something that you feel? And I'll talk about a couple of other things, questions with advantage plans. So
yeah, I think, well, because we have a helpline that people call when they're having issues, we do often hear negative things about advantage plans because people are calling to say, I was denied or I couldn't access a provider. We don't really hear from providers as often, but I do know that's sort of the paperwork that's required, or like working with the plans is not always a positive experience for them. But
I don't know how it can be. Not only do I purposely keep my landline because all my junk phone calls go to my landline.
Nice.
It must ring 20 times a day. And if I ever pick it up, it's always for an advantage plan. They promise everything. Free gym, a supplement, $300 a month extra for your groceries, eyeglasses, everything. They can't be spending as much money on television. Every ad is an advantage ad. They're spending a fortune on advertising.
Yeah.
The product can't be that good because they won't be making money. They obviously want to make money. I mean, do you agree? Or it is the most annoying thing, the advantage plan.
It's definitely annoying. Yeah. And the thing is, some people do, whether it's because the advantage plan is less expensive, they go for that. Right. Maybe they don't go to the doctor that often. So they're like, whatever, I'll just take this plan. I know it's maybe not going to be that great to work with, but I don't go to the doctor that often. I'll just use the gym benefits,
And I do have a doctor that will take it.
Exactly.
Maybe New York is different. When they say they pay for eyeglasses and hearing aid, do they just do a percentage of anything you buy? Do you have to say you have to buy this glasses? If I wanted to buy a Louis Vuitton frame, would they pay for it, or they only pay for part of it? Or in hearing aid, somebody said that you could only get a certain type of hearing aid. It isn't like they give you 30% of it.
Right. That really depends on. She's so happy. That really depends on the plan. I can't make a blanket statement about how they structure their payment for like glasses or hearing aids. Yeah, so it would have to be like, oh, this plan specifically says it covers hearing aids. How does it work? What brands do I have to get? How much, will I as the consumer be paying?
The last thing I'm going to ask is about regular Medicare. In New York, which is different from other states and maybe particularly Manhattan, many doctors don't take Medicare. You find you get the youngest ones. If somebody, I remember calling up Judy Schneider, who I think is still on the phone, they gave me the name. That guy isn't taking it anymore. If you were with that person straight through. And I had a conversation with a specialist, a GI guy, and he said, what's so unfair is that the internist or the specialists that are not surgeons get paid so little, where if you do a surgery that may take 25 minutes, they may get thousands of dollars, where he may spend 2 hours with a patient who was diagnosed with cancer and needs, special TLC and so on, and get paid $75 for it.
Mm-hmm.
How do we advocate? How do we do something to say you need to change, number one, the structure, and number two, doctors in Manhattan are not, even though you may say they're getting paid a little bit more than Vermont doctors, not enough to make up the difference for what their costs are.
Yeah, no, the reimbursement rates are definitely
and I don't know how to advocate. I've tried working with our congressperson. I've tried doing it, and nobody wants to touch it on a national level. And it is national, I guess.
Yeah, it would be national. Yeah, I don't have a great answer besides, trying to work with your elected officials, but I can check with our policy team, see if they have anything,
I would love
more
it.
specific, and then I'll get back to you because
that would be wonderful, Emily. I really like to. It's a very important thing. And if somebody does have a doctor and I knew somebody whose leg swelled up, an older woman, leg swelled up, she couldn't get an appointment like for 2 months or something and ended up going to the emergency room, which is not cost productive,
No.
not the way we want to go.
Yeah.
Thank you. So
Thank you.
Meryl still has a question. Is
I think
Ellen?
Ellen is unmuted too.
Ellen is unmuted, so let's go to
wonderful,
her.
Ellen.
I am. So you can actually hear me?
Yes.
Yeah.
Can you see me? Can you see me?
I don't know.
Mhm.
I have to go
We
back
can,
and
yeah.
look.
Oh, okay. So briefly, I saw myself on the screen, so I thought you might actually be able to see me. So I have the question. I wanted to go back to the maximum out-of-pocket questions, because I really don't understand how this works. Let's look at the maximum out-of-pocket for pharmacy.
Okay.
Does the out-of-pocket expenses, do the deductibles count in the out-of-pocket expenses?
It does, yes.
It does. Okay. So if I get a low deductible plan, if I get a low cost, high deductible plan, then it's way cheaper than a high cost, low deductible plan, because I'm thinking the high cost doesn't count towards the out-of-pocket expense.
Yeah, the monthly premium does not. So yeah, if you have a lower premium plan, you still have the $2,000 cap, but it's, the lower premium.
Right. So I have an out-of-pocket
rather than.
And I have a deductible. So if I have a high deductible, what does the deductible mean? Because I'm still getting a discount on the cost of my medication. So the pharmacy benefit manager is negotiating a discount for me on the medication. So I'm still getting some sort of a discount. So what happens after I hit my deductible? What then happens? Do they cover the entire amount? What happens to the medication then? I've never actually experienced it.
Deductibles are, confusing too, because a lot of plans will say, let's say we have a $590 deductible. They might say, okay, but the deductible doesn't apply to these like low cost generics. You could just go and get your thyroid medication without the deductible applying, and you have like a low copayment for that. But for, standard benefit. The deductible is what you owe. You paid like the retail cost under the plan, whatever they've kind of like negotiated the cost of the drug to be, the full cost. Once you've paid $590, then whatever co-payments the plan has for prescription drugs, they take effect. So, you know, if they say, oh, these tier 1 medications are $5 a refill, then you start paying the $5 per prescription rather than whatever the retail cost was or the out-of-pocket cost.
I see. Oh, okay. So and now there's going to be you said a $2,000 maximum out-of-pocket cost for prescription drugs.
Correct. Yeah.
Is
So
that how it
including
works?
the deductible.
Okay.
So yeah, if your plan has a $500 deductible, you don't have, you know, that's part of the 2,000. So then after you meet the deductible, you'd have $1,500 left to reach that cap.
And then what happens after that? Then we don't
After
pay
that, you pay
anything for this?
nothing. Correct, for covered prescriptions.
Nothing.
Nothing. Yeah.
Nothing. Not
For
even
the year.
not even the
Well, you
not
pay the
even
premium.
$5 deductible.
Correct. And not yeah,
We
not
pay the-
not
we
no
pay the premium.
co-payments. Yeah.
Oh, so we have no more of these $5 and $10 charges for medication, which actually seem quite cheap. So
Yeah, it was just an example. That yeah, I mean, $2,000 is still a lot of money. I think, you know, in the plan finders that we've been doing for clients, we've seen, you know, people who take like, you know, expensive specialty medications, that, you know, they hit that cap and that helps them. But people who are like, oh, I have, you know, like a cholesterol medication and a thyroid medication, like those don't really
I think
add up
somebody
to
has a blood
2,000.
thinner medication that's like $800 or $1,000 a month or something.
Yeah, so they would hit that cap like very
Right
soon.
away.
Yeah,
Wow, that's really good.
it is good.
So what Ellen is asking, just let me interrupt Ellen. Ellen is saying what you should do is go back to the drug plan and see if maybe a less expensive plan may end up being cheaper because so it may cost more per, but once you reach the 2,000, you're not doing anything. Right, Ellen? Is that what you're saying?
that's what I'm saying. Yes.
Wow.
But you have to find out if all your drugs are covered.
Correct.
Yeah.
Oh, so a
Okay,
cheaper
well-
plan may not be the same drugs. It may be different drugs.
That's
Okay.
correct. That's correct. So so you got to still use the plan finder
Exactly.
to find out the companies that carry your drugs.
But it's not
And-
just
and-
what drugs
and-
you're taking now, it's insurance. Like you don't know if 3 months from now you may need a special heart medication or something else like that. So it may be a more
Right. And-
general. Right.
Right.
Okay.
And then you got to figure out whether it's cheaper to hit your $2,000 or just like go and buy the drug at a Costco,
Mm-hmm.
you know, where you can get it for 1/20th of the price. So
Yeah. I mean, it becomes a full-time job, possibly
yeah,
looking at your different options.
right.
Yeah.
Well, now you add in the Advantage plans, which I want to point out. I was a broker for about a year. It's really hard to become a broker for Medicare because you have to take so many courses and it's so many hours of training that I think the brokers really want to get their money back, which is why they try so hard to push people into these Advantage plans. Because, you know, you get like $400 every time you sell an Advantage plan to a new Advantage plan to someone who didn't have one,
Mm-hmm.
or switching plans. You know, the insurance companies are spending a lot of money because and they're paying these brokers a lot of money to get people onto their plans. So you wonder, you know, where are they cutting costs for people?
That's right. That's what I was saying.
You know, I do want to point out one thing before I ask my next question about maximum out of pocket for Advantage plans.
Mm-hmm.
But I want to point out that the supplement plans, they have high deductible plans that most people almost never reach, unless you're hospitalized in a year, for a year, you're never going to reach your high deductible. And they're much cheaper. They're like $89 a month.
Right. Yeah.
For I think there's like high deductible plan G is like $89 a month for this, and it covers just about everything once you hit the deductible, which is high, which is quite high. But most people never reach their deductible in the year. Anyway, let me go back to the maximum out of pocket for Advantage plans, and the copays for Advantage plans, because again, I've only been on the Advantage plan 1 year, and then I went screaming from it because I actually got sick and I ended up in the hospital. And I had that waiting 6 months for a doctor.
Oh my goodness.
So it was like I took the Advantage plan. I prayed that I would be well, and then I was not that particular year.
Mm-hmm.
I had all the experiences of the step, the step treatments that they require, and having to get the mother may I before you could get treatments, etc. So anyway, I'm back in traditional Medicare, and I actually like the maximum, these high deductible, Medicare supplement plans.
Right.
So the other gotcha with the Advantage plan is the maximum out-of-pocket expense and the deductibles. Every time you go to a doctor, you pay a little bit more than you would under regular Medicare. So could you explain how that works? And, like how does the cost sharing work with the Advantage plans?
Yeah, so the maximum out-of-pocket limit under Medicare Advantage, we call it MOOP here in this table, the $8,850, it's met by the deductibles and co-payments and co-insurance that you owe for Part A and Part B covered services. So hospitals, doctors, prescription drugs are not a part of this. The plan structures are all so different. So that's why this table, sort of annoyingly just says like deductibles vary by plan, co-payments vary by plan. There's no set standard for what a Medicare Advantage plan has to charge really. Whereas with original Medicare, it's more standardized. And so again, with the Medicare Plan Finder, and maybe, Ellen, as you experienced as a broker, you can, see what the different plans charge for like primary care visits or a hospital stay. Like, will there be a deductible when I enter the hospital? What's the deductible for the year? Do I have to owe anything out of pocket before I go to the doctor? Before I have my co-payments, things like that. So yeah, hard to make a generalized statement about how much Medicare Advantage plans cost because they're all, pretty different. And thank you for sharing your experiences. It was really helpful. We have Meryl has a question.
Meryl, right, thanks.
Oh, sorry, you're not unmuted.
Now, what was this thing about good RX? For somebody who's, quite a bit younger or something like that, I would think good RX or any of the other things are an asset. What kind of penalties are incurred?
Yeah, so the late enrollment penalty for not having a prescription drug plan is 1% of the base premium, which next year is $36, about 1% of the base premium for every month that you were without prescription drug coverage. So if you delay for a year, you pay 12% more.
You're talking about under Medicare.
Under Medicare, yeah.
Okay, that's if the Medicare doctor prescribes some prescription. But if you just go for a cold medication or something like that, then GoodRx covers it, then you're not subject to penalties.
So I was, yeah, that's true. And I was mostly referring to like if you say, oh, I don't want to have a prescription drug plan because I'm just going to use GoodRx for everything. If later on down the line you need a drug plan through Medicare and
Then
you
you'll
didn't
have to
have
pay the
one,
difference
then you
between
have
the
the
plan and
penalty.
whatever you got in the way of, in other words, you have to pay as much as you would have otherwise paid had you had the plan the whole year, for example. Is that what you're saying?
Um,
In other words, you get a
maybe.
discount on a good RX, but you don't have the advantage of a year-long plan. So you have to pay 2,000 anyway, and plus you're paying something for your drugs, which would have otherwise been covered. I don't know,
Yeah.
something. That's not a serious penalty. I think I know what you're saying now. Thank you.
Yeah, no problem.
Thank you. If nobody asks questions, Emily, this was, I learned so much, and thank you so much, and thank you, Will, and I hope Rose does well, and thank you for the work she has been doing. Please tell her. We would love it if you give us some of the, and if you send me the policy person, I would love to work with them. And if we have questions, we're going to call on you.
Yeah, please do. Thank you all so much. And
Thank you so much.
yeah, have a great evening.
Great. Any other questions? Can we call it a night then?
Let me stop sharing.
Thank you, Will.